And when doing psychotherapy with outpatients, with individuals who have a history of intrafamilial abuse, what we find is that it can be really a challenge for the therapist. One of the difficulties when working with individuals who have a history of trauma is that a lot of people don't want to talk about it. It was back in their past, it was really painful, it was emotional. Sometimes they prefer not to think about it. Sometimes they forget about it or forget about how difficult it was emotionally for them. And so it's a real challenge, yet their trauma histories are still having an impact on them. And that's one of the reasons that they need help. That's one of the reasons why they're coming in for help. One of the reasons they're feeling depressed or having difficulty with interpersonal relationships is that their sense of trust has been violated. There's a sense of betrayal when you have a history of trauma, and that is such a hard thing to deal with. You have to deal with it, but you don't want to deal with it. And so it can be really challenging in therapy. And so what we did in our psychotherapy project in Toronto is to look at strategies to be able to work with these very challenging, help-rejecting, if you will, trauma survivors. What we found was that developing really good engagement strategies, strategies that help increase buy-in, really focusing on a collaborative approach where the individual can articulate what his or her motivation for change is. That's really, really important. And it can be quite challenging, but we have a number of engagement strategies that we've really articulated and done research on in order to be able to help these individuals be able to make a connection to the therapy process, which is one of the difficulties. What we find normally is that many people who have these histories of trauma and who have an avoidant, what's called an avoidant attachment style, that they tend to drop out of therapy after just a few sessions. So we really focused on strategies to help people be able to stay connected to the treatment process.